I breastfed for my 4 children. My name's Elizabeth Chetton. I've worked at the Brompton for 8 years. My role is a nursery nurse, breastfeeding advisor. Okay, well, the mothers would have been diagnosed antenatally with some kind of, their child would have some kind of heart condition, genetic or otherwise. So they would have antenatal sessions with CNS, which are the clinical nurses, antenatally. And we also get involved in that, and we go and talk to them about what to expect when they get here in terms of nutrition and feeding their baby. And most of them want to breastfeed, and they know when they come here, if they meet one of us, or not necessarily one of us, but anyone should know on the ward that there's a new mother. She needs to be talked to. So we do a tour, and we have a list that we sign off everything we've told them about how we're going to manage and help her express her milk. Because obviously most of the babies are too ill to be breastfed straight away. They may be having surgery, or they may be waiting for surgery, but they'd be on a drug, something, a Prostin or something, so it helps them. But we just help them, and a lot of the mothers say, "Oh, I don't have any milk." I said, "That's something we should talk about." So we go through the stages of milk, and most of them do really well. We have what we call Premi pumps and Premi things. So they start off straight away expressing. We used to do hand expressing where the mum would just try and squeeze out a bit of milk. But now these Premi pumps are amazing, so they can use them from birth. Because it wouldn't be a lot, it'd be about a spoonful. Because that's what the colostrum is. It's like a spoonful of medicine, but it's very yellow, and it's so about a spoonful, because at birth the size of a baby's tummy is the size of a marble. The mother would ask to say express for 5 minutes for the first expression. Double pumping, because we've got these pumps and they can use double pumping, and it's amazing. We'll try them for 5 minutes, and we probably want them to rest that night. But the second day, we encourage them to do 3 hourly for say 10 minutes, and actually once in the night, because all the milk that's produced is in the night is the best time, actually between 2 and 4. And then we explain, so mums come and say, "I don't have any milk, but your milk is coming in." "No, I haven't got any. Just wait 1 more day or 2 more days, and you will have lots of milk." And we're not worried about the amount you get. We're worried only about that your milk is producing, and it never happens that they don't. They do. And they can't cuddle this baby, and they feel, and I always say to them, they say, "I don't know what to do." I said, "This is what you can do. This is what you're doing for your baby." So we just think that's not going to be easy, but we encourage them every day, and we help them with practical things as well, like making sure they rest well. So we know we're sort of like mothers, and then you've got to go and have a rest this afternoon, and we say, "Have you had your breakfast, your lunch, your dinner?" Because we do believe when you're breastfeeding you need lots of nutrition, so we help them, and they also get complimentary food on the ward, especially on the 3rd day. Say, "How are you today?" "Well, I'm not okay, I'm feeling," and they just come out with the tears. It's hormones, and once this happens, you can cry all day if you want, because this is actually happy hormones, and it comes from the milk and the oxytocin, the hormone oxytocin. And I said, it's all happy hormone, happy milk, happy tears. So just cry. And sad too, because your baby may be having surgery tomorrow, and I can't hold my baby, and there's lots of issues. But once you help them with that, they just feel so relieved, and they come back the next day and they're saying, "Oh, Elizabeth, I've got the milk, I've got milk." Even if they have 10 meals, they're so excited. So it's keeping them feeling that they can do it, and they will do it, and with our help, they will do it. And most of them, after 2 or 3 weeks after surgery, they breastfeed. Again, we help them with that, help them to breastfeed, and it's fine. I think most of the time they're very happy. The mothers are very happy. Oh, actually no, one of my sons had congenital heart disease. I was like at the bedside, and I was like very worried. And now my son, if he's okay. He was operated on here, but that's why I love the Brompton. That's why I came to work here 8 years ago, because they've done so much for him. And now he's 23 and he's a dental student, and that's thanks to the Brompton and all the hard work for him. So that's my happy story. And a lot of the moms said, "Oh, thank you for telling me this, because I've got hope."